All right, good evening, everyone. Thanks, everyone, for stopping by. My name is Dr. Robert Brown with Elite Chiropractic and Rehab in Bloomington, Illinois. So I am super excited that you guys are all here tonight. Tonight, I've got a very special webinar for you. It's on the Master Controller, and it's the truth about chiropractic. And what if you could do one simple thing to completely transform the quality of your life? So without further ado, I'm going to get started on a PowerPoint that I have here. So I'm going to share my screen with you. And I'm going to ask you guys for some leniency and some mercy. This is the very first time I've ever used this video conferencing system through Zoom. And so I am figuring this out as we go along. And truth be told, I spent, probably 2 or 3 hours this afternoon creating the perfect PowerPoint for this. And then about an hour before the broadcast, I decided to clean up my desktop, and I accidentally deleted the PowerPoint that I spent all afternoon creating. So I was a bit of a nervous wreck coming into this, not sure how it was going to go. I expect that there are probably going to be some mistakes made on this, but we're going to learn from them, and we're going to continue improving every month as we bring you awesome webinar content every month. So tonight we're going to talk about the Master Controller. And to begin with, there are 5 main points that I want to drive home tonight. And the rest of this PowerPoint is going to really corroborate what we're talking about in this slide. So the first point is that the body is self-healing. So if you think about this, if your body gets a cut, if it gets a bruise or it gets sick, it does everything it can to heal, right? But let's say you put a Band-Aid or you put a cast on a cadaver. Guess what? Nothing happens. It's because the body is self-healing. You know, life heals. So when you get an injury, the body is generally going to heal from that injury. The second main point is that the brain controls the body. It tells everything in your body what to do. The third point is that the brain controls all the systems of the body through a complex network called the nervous system. The nervous system, it's like the Wi-Fi signals between your phone, the tower, and AT&T. That connection is what brings the signals and allows you to communicate to your family when you're out of town. And it's the same nerves that allow your brain to communicate with your heart, your lungs, your liver, your immune system, your adrenal glands, and every other system in your body. The fourth main point is that if you interfere with that communication, that's not good. It's not okay. And we're going to talk about that in more detail later. And then number 5, chiropractors are the only skilled profession in the world to locate, identify, and correct subluxations, which cause nervous system interference. So point number 1, we mentioned the body is self-healing, meaning the body is programmed to heal itself. Pills will only mask and suppress the symptoms. The cure lies within you. And point number 2 is that the brain controls the body. It is the control center for the entire body. It controls all the body parts and their activities. It coordinates and controls body processes like breathing, food digestion, and movement of the body and its various parts. The third main point is that the brain controls all the systems of the body through a complex network called the nervous system. Remember that Wi-Fi system that we talked about? And with that, the nerves from the nervous system, they go to all the organs in the body, like all of them. In fact, the nerves control every single function in your body. Let me give you a couple of examples of what's controlled by that. If you have a subluxation at C1, which is right at the base of the skull, it's the highest vertebrae in the neck. You could have headaches, migraine headaches, dizziness, anxiety, irritability, fatigue, restlessness, sleep apnea, high blood pressure, all kinds of things. If you go to the vertebrae right below that at C2, generally C2 and C1 are a package deal. They tend to subluxate together as a couple. C2, you deal with sinus and allergy issues. If you go down to T1, which is right about, it's the highest bone in the back. It's right where that hump is in your back. T1 deals with asthma and breathing difficulties. The vertebrae below that can deal with functional heart conditions like heart palpitations, irregular heartbeats. Then below that will be subluxated if you have pneumonia or bronchitis. Your mid-back will be subluxated in the event of having gastritis or heartburn or acid reflux or indigestion. My personal story is that I had heartburn many years ago, and the only thing that helped was a chiropractic adjustment. And once I started getting the chiropractic adjustments, it went away. But a funny thing happens. If I am to have a relapse of that, if I go for a little while without being adjusted, I start to get some heartburn issues. And then when I get adjusted, they go away instantly. It's the craziest thing. Now, if you go into the lower back, like L1, you can deal with intestinal issues like constipation, diarrhea, ulcerative colitis. If you go into the L3 vertebrae, you can deal with menstrual irregularities in women, like heavy bleeding, excessive bleeding, irregular menstruation cycles. Also, migraine headaches can correlate with that. And so you can see the nerves are not just about pain and how you feel. It's about functioning for your entire body. Now, we talked about if you interfere with that communication at all, that's not okay. So imagine this. Imagine that's your daughter, and she's on the side of the road with a flat tire, and let's just spice it up a little bit. Let's just say there's traffic whizzing all around her at 85 miles an hour, and you're unable to talk to her on the cell phone because of interference. That would be a bad thing. Obviously, that'd be a very frantic situation. You need that cell phone coverage to work. So that's what happens when you have interference to your nervous system. Imagine this. If you had a slip knot over your heart and it cut off 20% of your blood flow, would that be okay? No way, Jose. Not at all. Same thing is true with subluxations. We want to eliminate subluxations as much as we possibly can, because subluxations create interference in the nervous system. So now if you're asking, what exactly is a subluxation? Well, a subluxation is a misalignment of the bones in your spine. In fact, I'm gonna stop sharing my screen here for a minute so that I can demonstrate something to you. So if these are the vertebrae in your spine, okay, I seem to have a technical difficulty here. If these are the vertebrae in your spine, you have two vertebrae, and if they're in place, these nerves work. They come out of the spinal cord here. But if these bones are out of place, we call that a subluxation. The problem is it irritates these nerves. And so the only way to get the pressure off these nerves is with a chiropractic adjustment. And that puts the body in a state of ease. So I'm going to go back here to share my screen. And the next slide here, bear with me. Looks like we have someone new to the conversation. Welcome. Looks like we have an iPhone joining in. So welcome to the conversation. Okay, so the next slide here. Chiropractors are the only skilled professionals in the world to detect and correct subluxations, as we've talked about. And chiropractic adjustments remove interference to the nervous system. So the bottom line here is that you never want to leave a subluxation, because the subluxation, it's like the switch that turns on the power to your body. So if you're wondering, why are subluxations bad? If you haven't gotten the picture yet, why are subluxations bad? Well, the first reason that they're bad is that they mess up your posture, and it causes your spine to decay, and it causes your spine to develop arthritis. Similar to if you were to drive your car with 4 wheels and you never rotated your tires, guess what would happen? You guessed it, they would wear unevenly. And the same thing would happen to your spine if you never adjusted it. Now, think about this. I know I've had a cavity in the past. It's been a while, but have you ever had a cavity? And if you did you know about it? And did your tooth hurt? Most cavities are asymptomatic, meaning you have no pain. You just go in and the dentist looks in your mouth and says, hey, guess what? You have a cavity. And you're like, oh, bummer, It's like a moment of terror for me. I go in and I just pray that I just don't have a cavity because I don't want that drill going in there. But anyway, the teeth in your body, they decay in stages, and so does your spine. So just because you don't have any symptoms doesn't mean that your spine is healthy. In fact, if you look at this chart right here, you can see that there are 4 phases in your spine. And I won't get into all the details, but if you had a perfect textbook normal spine, you'd have a nice 45-degree curve, whether you're in the lumbar or low, which is the low back area, or whether you're in the cervical, which is the neck region. So what happens in phase 1? You guessed it, you lose that curve. So instead of having a nice curve here, this is straight up and down. Well, if you imagine building a 100-story skyscraper, straight up and down, guess what happens to the floors on the bottom? They get compressed. So most often patients come into the office with problems here between L5 and the sacrum. Also, we see a lot of them between L4 and L5. But these discs, which are shock absorbers in between the bones, they get compressed. And eventually the disc will bulge out and it can possibly herniate. And if it gets bad enough, it could require surgery. So as we go into phase 3, what happens is the disc is virtually non-existent at this point, and you get bone spurs that develop. And then when we get into phase 4, there's really nothing we can do in terms of providing correction for you. Your spine is essentially fused together. You lose bone density, and we are not able to make any structural changes to your spine. We are able to merely manage the symptoms at that point. So the next reason why subluxations are bad, they irritate the nerves as they come out of the spinal column, and this can lead to pain, tingling, numbness, and loss of function. And when you think of a pinched nerve, you think of pain, right? Well, only 5% of the nerves are for pain. The rest of them, guess what they do? Yep, everything else. And so I'm going to show you this chart here, feeling versus function. So we're going to get more detailed into the rest of the nerves. So we have autonomic nerves. They control the blood vessels, organs, and glands. It deals with sinuses, energy, digestion, breathing problems, basically all of your internal organs. We are able to evaluate how your autonomic nerves are doing through something known as a rolling thermal scan, which we have that in our office. Then we also have motor nerves, which control the muscles. And so when you are exhibiting problems with weakness, spasms, fatigue, and tightness, your motor nerves are going to reflect that activity. And we are able to evaluate your motor nerves in our office with something known as a surface EMG. But wait, it gets better. We also look at something called heart rate variability, and it shows us how stressed out your nervous system is, and it's a very strong indicator of your neurologic and cardiovascular health. And just to give you a very slight overview, this is what one of the views looks like on a heart rate variability scan. And patients, you'll get a white box here. We want it to be in this green oval. This is a well-adjusted patient or an ideally adjusted patient. This yellow ring around there is within normal limits, but could obviously use some improvement to become an ideally adjusted patient. Then we have an orange box around, an orange ring around that, and that's when you're having some significant problems. And then if you're way out in here, you need some serious help, because at this point you're distressed or weakened. If you're up here, you're uptight and exhausted. I can tell you I've seen patients within 30 days go from this distressed area into this ideal, optimal green area. And this heart rate variability is huge. It shows, I'm going to go back one slide here. It shows how stressed out your body is. So this line down the middle separates sympathetic from parasympathetic. Sympathetic is your fight or flight syndrome, kind of like you walk down the street and a big bear jumps out and scares you. Parasympathetic is the opposite of that. So when you have a sympathetic response, like a fight or flight response, I'm just going to read these to you because this is reflective of how people present in our office and just how people are in our society. So first thing it does is it increases your heart rate, increases your blood pressure, triggers emotional anxiety, chronic changes in cognition. We become overreactive. We become irritable, restless, depressed, tired, changes our appetite, causes tension headaches, raises our LDL levels, increases our cravings for fat and sugar. That's not good. Can lead to type 2 diabetes, inhibits your ability to sleep, decreases your immunity, makes you more susceptible to being sick, catching viruses, decreases our digestion, inhibits learning, memory, the ability to focus, inhibits logical behavior and short-term memory. It also inhibits the ability to concentrate and makes you more easily distracted. And this is one of the contributing factors to childhood ADHD. Aha, that's huge, isn't it? And also deals with bone loss and muscle changes. So we're able to look at your nervous system in its entirety through something known as a core score. And this core score shows your heart rate variability, your muscle tone, which are the motor nerves from your surface EMG, and your autonomic nerves from your rolling thermal scan. So we can really get a good idea of how healthy your nervous system is based on this core score. So that is the essence of what we do. You know, a couple of years ago, we were really focused on biomechanics of the spine and neck pain and back pain. We've revolutionized ourselves over the past year or two to become more of a health and wellness practice. You know, we tell patients, if you want to come in, just get out of pain, you can do that, give us a month. If you want improved health and you really want to be better, we tell you, it's going to take 2 or 3 months. And then we can talk about going on to wellness at that point, which is, where you come in for tune-ups. And again, just to reiterate, chiropractic adjustments remove interference to the nervous system. And so when you come in our office, you have a choice. You can choose to get out of pain, or you can choose to improve your health. I think about someone, if someone's, let's say, 53 years old and they've got 3 bulging discs and they've got degenerative arthritis throughout the whole spine and they're stiff as a board, they have no range of motion, a very poor quality of life. And let's say they have like 10 of those things we talked about on that huge list. Let's say they're anxious, irritable, they're constantly stressed out, they can't sleep, they can't eat, they're overweight. And we see them for a couple of weeks and get them out of pain. Over the course of their life, how much have we really helped them? The answer is really not that much. If you just come in for a short period of time, we're just putting a Band-Aid on your problem. And, we're not really into Band-Aids. We'll put a Band-Aid on there for you if we can fit it in our schedule, but we really have a passion to impact people and help improve their health and, their quality of life. That is what we are about. And the last slide here, we always do have a new patient offer. So if you have terrible insurance or you have a high deductible or you have no insurance, an offer we have is we will do your entire first visit and your report of findings. So your first visit, you come in, we'll sit down and do a consultation history where we ask you what's bothering you, what's giving you trouble, how long have you had this problem. We'll just get a complete history. Then we'll do a complete nervous system scan where we look at everything we just talked about. We'll do a complete neurologic, orthopedic, and chiropractic evaluation, a full set of x-rays. Then on day 2, we'll do a report of findings consultation where we'll tell you all of our findings, and we will do all of that for only $125. In fact, that's the cost of our x-rays. So basically, we're throwing in everything else except the adjustments, of course, if you come in and do that. So that's a nice new patient offer. It gives you a chance to get your foot in the door without spending a fortune. And that is something that we like to offer. So anyway, that is the end of my PowerPoint slide. So I hope that you've enjoyed this as much as I have. It's been a pleasure to talk to you. And just to set you up for next month on Tuesday, May 23rd, we are going to do our next webinar. And it's going to be about stress in the nervous system as well. It's going to go into some other really interesting things too. So that'll be at 6 o'clock on Tuesday, May 23rd. And if these continue to become more and more popular, we're going to do this every month because I love doing this for you guys. And it's a way to help reach out to people and really educate them on what chiropractic can do for them. Only 10 to 20% of the population receives chiropractic care or has ever received chiropractic care. And that's a shame. You know, most people, when they have problems, they take a drug for it. And a drug or pill will not fix the underlying cause of your problem. That's where chiropractic comes in. And I'm a chiropractic first kind of guy since I am a chiropractor. And, you know, that is our mission, is to provide the highest quality of health and wellness care to the Bloomington Normal area. So anyway, that's all I have for tonight. Thank you guys so much for your time. It has been a pleasure. And you guys have a great evening, okay? You take care, and we'll see you soon.